Our aging parents consist of what's called the silver tsunami, an age where their health might start taking a dive. And that's why the health industry is trying to build a healthcare system that benefits the most vulnerable, our seniors, and everyone else here in the Valley as well. In fact, there's an exciting partnership between Humana Medicare Advantage, Kaweah Delta Healthcare District, and Key Medical Group. And here to explain how it all works and how it's going to help you is Ryan Gates. He is the Director of Population Health Management over at Kaweah Delta. Ryan, thank you for being here. And then we have Dr. Jeff McManus. He is the California Medical Director at Humana. I welcome both of you. Happy Friday. Happy Friday. Let's start with you, Doctor. Explain to us this exciting partnership between Humana Advantage and Kaweah Delta.
So, like we always say, is that all healthcare is local. So, for us to really be successful and get the best care for our members and the best outcomes, we're a health and wellness company. Okay. So we have to get involved with the physicians at the base level as well as the hospital, the ones that are actually taking care of our members. So we're very excited to be able to put this together with Key Medical Group and Kaweah Delta, and having Humana as the third leg of the stool. It's really one of the proudest moments of my 30-plus years of Medicare Advantage to do this, to work with this fabulous team that they have. Wow, because a lot of people think Humana and all of a sudden think insurance, right? And you do so much more than just provide insurance. At least, is it a local chapter of Humana, or? Well, Humana's national. You know, we have over 3 million Medicare Advantage patients, so we bring a lot of expertise in the area and best practices that we can put together with Key and Kaweah Delta to try and really improve the health and wellness of our members. And this is because of the growing number of baby boomers, I'm sure. There's 10,000 every day aging in, and the most vulnerable of the population too. Yeah, and sometimes the people forget about them the most, right? Which is so sad. Okay, Ryan, we're talking about this wonderful partnership, but how do you play into it all? How does Kaweah Delta play into it? And tell us about the role of the Chronic Disease Management Center.
Right, so Kaweah Delta formed the Chronic Disease Management Center. This center is really designed to take care of the most vulnerable in our community that suffer from chronic illnesses. You know, there's a thing we call the 5% rule. 5% of our patients across the United States, and true in Tulare and Kings County, 5% of the patients consume or use 50% of the health care resources. And these patients are the ones with multiple chronic conditions and very complicated issues. Like what? Because a lot of people that are sick think they have chronic diseases, right? That's right. So we've developed comprehensive programs for diabetes, heart failure, COPD, we're going to talk a little more about today. We also have pain and palliative care and transitional care. And these patients really require an interdisciplinary team, not just physicians, but nurses and pharmacists, et cetera, to surround the patient. Again, these 5% are with the complex issues. And so we've worked hard together with Humana and Key Medical Group and Kaweah Delta to form the Chronic Disease Management Center, where we can take care of those patients in our community.
What is COPD, doctor? What exactly?
Well, it's chronic obstructive pulmonary disease. So COPD isn't, you can't put your finger on that COPD, right? COPD, they kind of land in a triangle. That's asthma, emphysema, and chronic bronchitis. Most patients fall somewhere in that triangle. They may lean more towards one than the other, but they're in that triangle. So COPD basically is an obstructive disease where the airways tend to collapse and makes it hard for them to breathe. And how will this program help those people? Well, because you mentioned that it's kind of step by step from the beginning, right? It is, and so many causes of chronic obstructive pulmonary disease, right? Tobacco, obviously, being the biggest offender, but there's also other things that we used to call them occupational lung diseases, which is why you sort of why commercial painters now wear respirators, right? Because they've identified that there's lung disease associated with all those exposures.
Wow. So I'm so glad that you're talking about this, because obviously we live in an area where the air is so bad. So many people probably deal with these problems of COPD. Okay, how did you even come to partner with one another?
We knew we needed to do something different to care for, particularly our Medicare patients. And in original Medicare, Medicare fee-for-service, there really isn't this wraparound support from a health plan and from the local physicians in the hospital. And so in Medicare Advantage, like Humana, it really brings a lot more to the table to help coordinate the care of the patients.
So is this only for people that have the Humana Medical Advantage plan, or is it for
So the Chronic Disease Management Center isn't payer specific.
Okay.
However, the program we're talking about today, we did develop in tandem with Medical Group and Humana, and shaped the benefit around this program, honestly.
And you're also making it possible for those that may not be able to afford it.
Correct.
Yes. So to learn more, where do we go, doctor?
Well, to learn more about Humana Medicare Advantage plans, this is the perfect time because we're in open annual enrollment period until December 7th. So you can call the 800 number and they'll connect you with an agent and someone who can walk you through it.
Yeah. And what if we want to learn more about the Chronic Management Center there?
Yeah, the Chronic Disease Management Center down there right on the hospital campus, and visit our website on at kaweahdelta.org.
Exciting things going on in the medical field there in the South Valley and throughout the Valley. So I really appreciate you telling us about it. Thank you.
Thank you
for being here. Appreciate it. All right. Still to come here on Central Valley Today. Close to 19 museums in the Valley will be open for business tomorrow for free. And we've got all the details next.